I want to thank Cancer Grace for inviting me to talk today on this very important topic of KRAS and BRAF. These are my disclosures. So KRAS and BRAF are a little bit different than all the other genes that you've heard about that are largely kinases. And a kinase that you've heard about earlier, they typically respond to some kind of signal on the cell surface. And in response to that signal, will then activate a protein just below there and then transmit that signal basically from the outside of the cell to the inside. KRAS and BRAF are those second signals. So in the little cartoon that I'm showing you here, most of the things that we've been talking about so far are this pink molecule on the cell surface. And this pink molecule on the cell surface typically activates some kind of secondary protein that moves the message from the cell surface all the way down into the nucleus. Now, KRAS and BRAF are both very similar agents, very similar proteins, and they transition between an active and an inactive state. And in the process of doing that, they burn phosphorus and then activate a signaling cascade that goes down into the nucleus and has the cell start doing whatever it is that cell normally does. Now, many of you took high school biology and you remember mitosis. And mitosis, you'll recall, is basically cells dividing. And so these cells, in response to activated signaling, will divide. And they'll also do whatever it is that that cell is designed to do. So if it's a mucus-producing cell, it'll make mucus. And for many of our patients with lung cancer, that's one of the main functions that these cells do. So in addition to growing, these cells will also receive survival signals. So one of the things that cells have innately is that they recognize if things are kind of broken inside of them, if their DNA is broken, if their proteins are broken, they're supposed to die. And they'll turn on these programs called apoptosis programs to do that. But if they're constantly stimulated through these signaling pathways that KRAS and BRAF are such an integral part of, they won't listen to those other signals that are telling the cell to die. Cancer cells have many aberrant things about them, and there are many internal proteins that, if they were allowed to, would have the cell simply undergo a cycle of programmed death. But activation of KRAS or BRAF and the turning on of these pathways really prevents that from happening. And so patients who have mutations in KRAS or BRAF within their cancers, they will always have these growth and division signals active within them. Now, we've all been learning about how lung cancer is not one disease and how different signaling mechanisms really define lung cancer. KRAS and BRAF are largely adenocarcinomas, and we will see KRAS signaling in about 40% of adenocarcinomas, 25% of adenocarcinomas down here. And BRAF signaling, much less common, about 2% of the adenocarcinoma patients will have that. We don't really see very much KRAS or BRAF signaling in the squamous cell carcinomas.